Hello, this presentation is on sciatica and lower back pain. However, it is not what you may expect. As an introduction, what is being presented here are two parts. The first part is how do you safely exercise your low back without hurting your low back? And the second part is how do you strengthen other body parts without hurting your low back or increasing the amount of sciatica. There's a main concept you want to keep in mind when doing these exercises, or any exercises when you have low back pain or sciatica. Minimize compression. Minimize the compressive forces on the spine. And how do you do that? That's a big question. The way you do that is to do as many exercises as possible in the lying down position. You can lie down on the floor, you can lie down on the bed, you can lie down on a bench, or you can lie down on a special pad. But the main thing is to avoid compression as much as possible. Avoid standing weight exercises especially. Now, as an introduction, we're going to introduce 4 exercises for 4 different body parts. It's just going to be a sampling of what can be done. And in this sampling, I want to emphasize again, when you do the weights, don't pick up the weights someplace and bring it to where you are. Leave the weights on the floor. Go to the weights. At home, when I do these exercises, I put them under my television set so that I can be watching TV while doing the exercises if I wish, to catch the news at the same time. But I don't carry the weights and put them from one position to another. Thank you, and we will progress to our exercises. Notice that these are dumbbells. These particular dumbbells are 10 pounds, but you can use any weight which is comfortable for you. You can start with dumbbells as low as 2 pounds and move up to dumbbells which are 20, 25, 30 pounds. Chris is a big guy. 10 pounds is a little light for him, but it's a way of demonstrating the use of dumbbells. You always want to do or use a weight which is comfortable for you. This is very comfortable. He can repeat a set of 12 to 15 repetitions after this if he wishes to move up in weight or stay at a level which is comfortable for him. The main concept is use something which is comfortable and does not create strain. Another very, very important part of this exercise here is that you're doing these exercises to strengthen various parts of your body so that you don't irritate your low back or create more exacerbation of your sciatica. To do that, when you're exercising on your back this way, it's important to leave your knees up, bring them up, your feet are flat, and in doing so, you flatten your back, creating a little bit of traction on your back and decompressing your spine. So notice also that there's a pillow under the back of his head, so his head isn't extended, and he's in a comfortable position. He's not straining. He won't end up with any type of neck problems as a result of this exercise. This first exercise is called floor presses. Christopher, you want to pick up the dumbbells, please, and bring them to your sides with your arms at right angles like this. Okay, bring them up, please. All right. Now I want you to push towards the ceiling and bring it back down. All right. Now take a deep breath. Push up. Now exhale as you go down. Inhale, push up. Exhale, go down. Now you're going to do 12 to 15 of these, 12 to 15 repetitions. And as you're doing these, visualize that you are exercising your chest, the front of your shoulders, and the back of your arms, called the triceps. This is a major body exercise. It's good for pushing. It's a very basic exercise. After you're done with the 12 to 15 repetitions, just put the weight to your sides, Chris, and you'll be done. Let go. And that takes care of the very first exercise, which is called floor presses. The next exercise is called floor curls. Curls are for strengthening the bicep muscles or the front of the arms. And notice that Chris is in the same position as he was in before. His head and neck are supported with a comfortable pillow. His knees are up. His knees are up so that the low back is flattened. There's a little bit of traction to the back, a little bit of decompression of the spine in that position. In this position, notice that his palms are up. He's using a comfortable weight, which is 10 pounds, but you can use any weight that you wish which is comfortable for you. You can start with 2 pounds, work up to 5 pounds, or use 10 pounds. We're going to demonstrate now the use of a curl for his bicep. Chris, will you curl the weight? You can stop about here at about 90 or a little bit beyond 90 degrees. Palms are up. Okay, let it down to the floor. All right, repeat that about 11 or 12 times. And notice that he's exercising his biceps, the front of the forearms. Now, it's not necessary, but it's helpful and recommended that as you do the major curling, the major lifting, you take a breath. As you let the weight down, you let the breath out. So, inhale, exhale. Inhale, exhale. Now, when he reaches 12 to 15 repetitions, whatever he chooses, he can rest and repeat another set if he wishes. Thank you very much, Chris. Our next exercise is a non-weight exercise, but it is a strengthening exercise for the stomach or your abdominal muscles. It is called the stomach tucks. In this position, we're in the same position as we were for the previous exercises. The knees are up, the feet are flat, and in so doing, you flatten the low back, you take some pressure out of the low back, you decompress the spine in the low back, reduce the pressures in the low back. It's a safe exercise for low back and for helping to prevent further sciatica. If your legs are straight, then your back is arched and you get more compression. So we want to keep the knees up for all of these exercises on the floor. Now, we're not going to coordinate the breath on this because it gets confusing for some people. So we're just going to have you breathe normally, and I want you to suck your stomach in as far as you can. Now relax and let it out. Okay, suck it in and let it out. You're going to do 12 to 15 or more of these if you like. Now, in so doing, every time he sucks his stomach in, he's contracting his abdominal muscles or his stomach muscles. But also, the added benefit of this very, very simple exercise is as he sucks his stomach in, he flattens his back, creates some traction to his back, decompresses his low back, and takes potential pressure off the sciatic nerve. So it's a very, very good and safe exercise. But I have to make one caution. If any of these exercises cause any discomfort or cause you any concern, back up on them, eliminate them if they need to be eliminated, or do something that makes you feel a little easier when you do the exercise. So if, for example, sucking his stomach in causes a little bit of back pain, then don't suck it in quite as much. You want to observe safety as much as possible when doing these exercises. Okay, Chris, are you tired from doing these exercises?
Yes.
Okay, you can stop. Then you can rest, and you can repeat this whole process once or twice. Our next exercise is called table rows. The table rows are for the back muscles, the upper back muscles especially, the muscles behind the shoulder, and they work a little bit to the bicep muscle. It's a rowing motion, a pulling motion. To do this, you need to have a little coffee table or a little chair that is approximately 12 to 16 inches high that you can lean on. And Chris is going to demonstrate this for us. He's going to lean forward with his left arm. He's going to be pulling with his right arm. And at this point, he's going to grab the weight, and we're going to keep the head sort of parallel with the rest of the body. Make sure he flattens his low back. Go ahead, flatten it to the point of comfort. If flattening it too much causes you any discomfort, then you can round it a little bit more. But we try to keep it straight as possible. And at this point here, Chris is going to inhale slowly and then pull the weight up to his rib cage or stomach, whatever is comfortable, in a comfortable way. Let it down and exhale as you let it down. Now inhale and pull it up. Exhale, going down. Now keep going, Chris. As he does that, he'll be working the muscles medial to his scapula, the muscles behind the scapula, the muscles behind the shoulder. He'll work even some of the muscles down to the lower part of the torso or the thoracic spine. And as he pulls, he's going to be utilizing the bicep muscle in a different way. So you can do 12 to 15 reps. Notice also that his head is parallel with the rest of his body. If he puts his head up, then he's going to be hurting his neck. You can put it parallel to the body or even let it hang down a little bit if that's more comfortable for him. All right, after you've done 12 to 15 reps, whatever is comfortable for you, you can stop. And then you switch to the other side. You're going to put his right arm down like this. And we're going to straighten the low back. The head's going to be down slightly. He's going to row with the other arm in the same way you saw on the right side. Inhale, exhale. Inhale, bringing it up. Exhale. He's going to be working the back of his thoracic spine, the back muscles here, the back of the shoulder blade, the back of the shoulder. It's a very good overall exercise. Now, the reason we're leaning this way is that if he puts the full weight on his shoulder or his arm this way, provided you don't have a bad shoulder, then you don't have any weight at all or any contraction, major contraction, put it that way, on the lumbar spine. So you're able to do a pulling exercise without injuring the low back. Thank you very much. Now Chris is a real young, vibrant individual. I'm an older guy. I want you to understand that you don't have to be real young to do these exercises. I'm 71 years old. I do these exercises myself. I have several herniations in my spine, and these exercises do not bother me if I do them properly. If there's something I do which bothers me, I step back from it. But what I'm giving you here, you can test on yourself. If it works for you, then continue. If you need to make a slight variation for your comfort, go right ahead. I'm going to start with showing you how I do the exercises myself at home. You keep the weights on the ground at all times so you don't have to be lifting them up and carrying them from one place to another. I'm going to start with my right side. I'm going to be doing the table rows for my biceps, for the back of my shoulders, for my back. My head is down. I'm leaning my full weight on my left arm. My low back is straight or slightly arched. Now I'm going to do 12 to 15 reps. I'm going to inhale, pull it up, exhale, let it down. Now when you pull it up, you don't have to be at any particular angle. Whatever angle is comfortable for you is the angle you take. So whatever feels natural for you. So inhale, exhale. Inhale, exhale. Inhale, exhale. Until I reach 12 to 15 repetitions. Then I move the weight over to the other side. I switch arms. I'm leaning my full weight upon my right elbow. My head is down. My back is straight. I'm going to inhale, pull up with my left arm, and let it down. Inhale, exhale. Inhale, exhale. Inhale, exhale. In doing this, I've done a pulling motion, which is useful for my biceps as far as pulling is concerned, for the back of my shoulders, for the back of my shoulder blades, and for my back muscles in general, the upper back muscles. This next exercise is called the floor presses. The floor presses are used to exercise your chest muscles, the front of your shoulders, and the back of your upper arms called the triceps. You do this in a position on your back again in order to decompress your spine so that there's minimal amount of vertical pressure on your spine. Your spine is slightly straightened by the fact that your knees are up, your feet are flat. You've got a little tractioning of the spine there, taking some of the pressure out of the spine. If you were to leave your feet straight out this way, you'd have an arch in your spine, which could cause some compression, irritate your back, or possibly irritate your sciatic nerve. So we bring the knees up in this position. From this position, I grab the weights. It's important when you're doing these weight exercises also to leave your weights on the ground so that you don't have to lift them and take them from one position to another. We're going to start the exercise. The dumbbells are to the side. If the dumbbells were to one side and you had to move them, don't bend over while you're standing and move them. Get on your back, grab the dumbbell, Bring it over to the side so you don't have any vertical compression on your spine. Make sure your head is comfortably supported by a pillow. Grab the weights. These are 10-pounders. If I needed to use a lighter weight, such as a 5-pounder or a 2-pounder, I would do it. Or if you want to go a little heavier, you can do it as well. The main thing is that you're completely comfortable and you're not straining. So now I'm going to curl the weights to this position here. From this position, it doesn't matter whether your weights are at this angle or that angle. The main thing is you inhale through your nose, you push the weight towards the ceiling where your arms are extended, and you bring it back down. I'm going to inhale, exhale, inhale, exhale, inhale, exhale. Now I'm comfortably exercising the upper part of my body by strengthening the muscles of my chest, the front of my shoulders, and my triceps. I'll do a set of 12 to 15 repetitions. When I'm done, I'll set the weights down. I will rest and do another set, or I can go right from this position here into the next exercise, which is going to be called your bicep floor curls. With my palms up, I will inhale, curl the weights to about 90 degrees, let them down. Inhale, exhale. Inhale, exhale. Inhale, exhale. Now when I've done 12 to 15 repetitions of those, I can go back and do a second set of presses. And just go to 12 to 15 reps. When I'm done there, I'll go to a second set of curls. All right, so these curls again are exercising my bicep muscle, the muscle in front of the arms. So far we've done exercises with the presses, exercising the chest muscles, the front of the shoulders, the triceps. We've done the biceps with the bicep curls. We've done the rows with the back of the shoulders. And we have done the stomach muscles by doing the tuck. Now this is a sampling of exercises which you can do. There are other exercises for other parts of your body or for strengthening various parts of your body at different angles, but this gives you a sampling of what can be done in a very, very quick period of time. Thank you very much for listening.